Injections for pain management, it's a very broad topic because when we talk about injection, it's not one particular area or one particular type of substance, and it's not one particular type of procedure. I can give you examples of some of the injections that are used in the management of pain. And majority of those injections are neither painful nor have many side effects. These are simple injections, sometimes going from dry needling, which has no medication. You can use numbing medicine to make the patient comfortable, but it's a regenerative medicine technique where you stimulate the tissues that are causing the pain, that are resulting in chronic symptoms. The new blood circulation and stem cells are stimulated and the tissues start healing. To going to next step where sometimes we have to use either some kind of a steroid or phenol or dextrose to do prolotherapy. And prolotherapy is a type of injection where you stimulate weak ligaments or loose ligaments to make them tighter. It's an old-fashioned treatment, but it's still useful in many of the musculoskeletal treatments. Other injections include joint injections, and say for example, if we just take knee joint, which is a very common problem. Patients come with osteoarthritis and knee pain. Almost daily I see patients with knee pain. And some of those patients require injections. And when you come to injections, if somebody has an acute inflammation, young person who just has, for example, bursitis or tendinitis, then we may give them a steroid injection. People are afraid of the word cortisone, and cortisone is an old steroid, but there are newer generation steroids, which are, some of them are milder, some of them are not toxic, and some of them have very little side effects, if any, and the doses that are used are very small as well. So some of those injections are very effective, and some of those injections are very commonly used in musculoskeletal and sports medicine practice. Other injections that we may use are called hyaluronic acid, which also people know as oil injections or ibrazaithia. And those are used when somebody has dry joints or has osteoarthritis or khushune, and we use them to prevent friction or ihtikak. And by reducing that, you reduce the causes of the pain. Now, there are even more advanced treatment options available. Besides the oil injections, we have a new product called Chiomedine. It works as a soft gel. This is used for advanced osteoarthritis, somebody who will not benefit from oil and their only resort is having joint replacement done, and they're either not a candidate for surgery because their health doesn't allow that, or they choose not to have surgery done. In that case, these kind of injections can be used. Another product that I very frequently use, and it's very commonly used in sports medicine, is plasma or PRP, which is platelet-rich plasma. This is your own blood. Some patients understand that ibradam. If you take your own blood, we remove the cells from using a machine, and then we take the fresh plasma at the same time, and we inject it either in your joint or any of the injured tissues to help stimulate the regeneration and repair of the tissue. So it's a regenerative medicine technique. But these are not the only injections. This was just an example of using injections for knee osteoarthritis. And my specialty besides rehabilitation medicine is also pain management, and we use many other types of injections. For example, we can use nerve block. Today only I had a patient with severe pain in the back of their head, and there is a nerve that can cause pain in that area, and by blocking that nerve you can significantly reduce the pain. And I did an occipital nerve block for this patient and had a very good benefit. But nerve blocks can be done in many parts of the body. Occipital nerve is just one of the examples, but in many parts of the body, for example, carpal tunnel syndrome, we have patients, if it has gone past the stage where physical therapy and splinting and medication is not enough, and patients are still having symptoms or there are signs of nerve injury, we can use an injection in the wrist for carpal tunnel syndrome, and that in many cases gives you very good results. Patients, especially when they are reluctant to do surgery or surgical risks are significantly high, there are many other modalities where a patient can be treated without surgery, and that's what my specialty is. So that's why I see a lot of patients who have these musculoskeletal problems, and I try to treat them without having surgical intervention.